Hello, and welcome to my CSB346 capstone video assignment. Today, we will be discussing interprofessional communication in the field of paramedicine and its relevance to my future as a paramedic. We will be particularly discussing clinical handovers, an important aspect of the paramedic profession. We will be discussing this topic utilising the 5 R's reflection model. This model entails the headings reporting, responding, relating, reasoning, and reconstructing. Let's begin. As a paramedic, interprofessional communication is an essential part of the profession. It is utilised daily and occurs between paramedics themselves, communication operators, nurses, doctors, and a variety of other healthcare professionals. As a student paramedic who has completed over a total of 750 hours of clinical placement, I have both observed and participated in interprofessional communication in a variety of clinical settings. One of the most common clinical settings that I have witnessed paramedics utilise interprofessional communication skills is within clinical handovers. I have both observed and participated in a variety of clinical handovers that have transpired between paramedics and the emergency department teams at hospitals. Throughout my limited clinical experience, I have been able to quickly recognise and appreciate the importance of effective interprofessional communication skills and high-quality clinical handovers. As a future paramedic, I want to ensure that my interprofessional communication skills are of an excellent standard to ensure that I am delivering high-quality clinical handovers for all of my patients. Throughout my clinical placements, I have witnessed some truly excellent clinical handovers in both low and high acuity settings. I found that after witnessing such great handovers, I am left feeling motivated to improve my interprofessional communication skills so that I too can deliver high quality handovers. As previously mentioned, having both observed and participated in a number of clinical handovers throughout clinical placement, I realised very early on in my degree that the ability to deliver a superior clinical handover is a true skill. I still find myself, following 750 hours of clinical placement, experiencing feelings of nervousness when it comes to delivering a clinical handover, especially when it is in relation to a patient of high acuity. To this day, I'm still developing my interprofessional communication skills and improving on my delivery of clinical handovers, even though I am at the end of my degree. Alongside high-quality clinical handovers, I've also witnessed and delivered clinical handovers of a poor standard. I understand that as a student, delivering poor handovers are a given. However, I noticed a common theme when delivering a poor handover. I commonly felt that it was poor because my thought processes were scattered, which ultimately confused the handover recipient. After delivering a poor handover, it leaves me feeling discouraged and that I failed as a paramedic to a certain degree. Observing and delivering poor quality handovers, however, does provide me with the excellent opportunity to reflect and learn from the mistakes. I often question what strategies I could implement next time in order to improve upon my interprofessional communication skills and subsequently deliver a high-quality clinical handover next time. All of the clinical experience I have gained in regards to clinical handovers, both positive and negative, has allowed myself to develop thorough interprofessional communication skills that will lead into the ability to deliver great clinical handovers in the future. Prior to attending clinical placement, I became aware of the importance of interprofessional communication and clinical handovers throughout my university studies. Through a variety of subjects and teachings, I gained a significant level of theoretical knowledge and understanding regarding how to communicate effectively, as well as specific strategies that I could potentially implement in my clinical practice in order to achieve high-quality interprofessional communication skills. I have learnt throughout my study, whilst theoretical knowledge is extremely beneficial when it comes to improving upon interprofessional communication skills, in order to truly master interprofessional communication, It requires real-time experience. Having worked in an environment that involves communication with a variety of people since the young age of 14, I have been consistently developing my communication skills throughout my life. This working experience has allowed myself to develop a strong foundation of communication skills, and I feel confident in my abilities to already be able to build rapport with patients and speak confidently. What I lacked experience in was communicating clinically. Both university and clinical placement was an opportunity to develop my ability to clinically communicate in situations such as a clinical handover. I'm still continuing to develop my interprofessional communication skills, and whilst they have improved significantly since beginning university 4 years ago, I'm still continuing to develop and perfect my skills, and will continue to do so in the many years to come. Interprofessional communication is critically important in the field of paramedicine. With a clear association between miscommunication and poor patient outcomes, it is imperative as a paramedic to possess high-quality interprofessional communication skills. Ferunda MacArthur, McWilliams, 2016, discusses that ineffective communication in healthcare can result in medication errors, including accidental overdoses, delayed treatment times, misdiagnoses, patient injury, or even death. It is for these reasons that effective interprofessional communication skills are imperative in all healthcare workers, including paramedics. Clinical handovers are an example of interprofessional communications that paramedics are actively involved in on a daily basis. Redley, Boddy, Wood and Bucknell, 2017, discusses that a clinical handover involves transferring the professional responsibility and/or accountability for a patient to another professional. As a paramedic, clinical handovers are conducted in a variety of settings. Two of the most common clinical handover settings, however, include handover from paramedic to paramedic in the pre-hospital setting and paramedic to the treating team at the hospital, whether that be to a triage nurse, treating nurse, and/or doctors. Communication errors within clinical handovers are a significant contributor to poor patient outcomes. Potential barriers in effective communication within a clinical handover include, but are not limited to, a lack of confidence, a lack of experience, the complex nature of the patient, distracting factors of healthcare settings, for example, loud and busy environments, and a lack of structure and standardization. So what makes a good clinical handover? Wood, Crouch, Rowland, and Pope, 2015, discusses that paramedics who delivered clearly stated, confident, and succinct handovers with the ability to be assertive and speak loudly were the most effective. The authors further discuss that it is not only the paramedic delivering the handover that makes it effective, but the receiver's ability to actively listen. Listening is just as important as speaking in interprofessional communication, and if the personnel receiving handover has a lack of attention or is not actively listening, a poorer handover can result. Dawson, King, and Grantham, 2013, discusses that there are 6 aspects that could potentially be improved upon to ensure a high-quality clinical handover is delivered every time. These aspects include professional relationships and respect, the need for a structured handover tool, multiple/repeated handovers, education and training in handovers, vital signs, and documentation. Let's discuss these further. Professional relationships and respect. As previously discussed, being confident, succinct, and assertive are all important interprofessional communication skills to possess when delivering clinical handovers. Just as importantly, it is important to be an active listener. As healthcare professionals, it is important that they are trusting and receptive of each other's knowledge. Having a high level of respect within a professional relationship may allow for a more inspired and confident handover to be delivered, subsequently encouraging the important cooperation and teamwork between professionals that is required for positive patient outcomes. Structured handover tool. Employing a structured handover tool, such as ISBAR or AMIST, is beneficial in providing a guideline for how to deliver a clinical handover. It ensures the most pertinent information is delivered and that important information is not forgotten. Multiple/repeated handovers. 91% of paramedics hand over their respective patients at least twice. Dawson, King, and Grantham, 2013, discussed that multiple studies have identified that numerous handovers contribute to information being lost or altered. Whilst it is unavoidable in delivering a handover more than once, employing such strategies, such as a structured handover tool, may prevent important information being lost or misconstrued. Being aware of the possibility of multiple handovers can allow for one to prepare. Education and training in handovers. Studies show that 83% of paramedics feel the need for more formal education and training in clinical handovers. Face-to-face training between paramedics and emergency department personnel has shown to improve mutual respect, staff attitudes, team behaviours, and reduced errors by up to 60%. Vital signs. Within clinical handovers, a patient's vital signs are considered one of the most valued pieces of information. It is important to hand over baseline observations and those outside of normal parameters. And it is also important to ensure emergency department staff document such information. Documentation. Documentation completed by paramedics is a permanent record of what pre-hospital care has been administered to the respective patient. Documentation supports a clinical handover and once again can prevent the loss of information communicated through a clinical handover. Following all of my experiences and theoretical learning, I ask myself, how can I utilise this information to inform my future practice as a paramedic regarding interprofessional communication in specific relation to clinical handovers? Well, I will actively involve myself in communicating with a variety of people in my part-time job. Equipped with the theoretical knowledge I have gained from university regarding interprofessional communication, I will work towards placing such knowledge and strategies into my clinical practice. Throughout the remaining of my clinical placement, I will take every opportunity to practice clinical handovers and utilise interprofessional communication skills whilst under the guidance of my mentors. Seeking invaluable feedback from my mentors as to what I excelled in and as to what I can improve upon will only add to my knowledge base regarding interprofessional communication and provide me with the guidance as to what I need to focus on improving. From this reflection, I also now understand the certain features that allow for a good quality handover to be delivered. As a future paramedic, I will work towards delivering clearly stated, confident, and succinct handovers. I understand that these skills will develop throughout experience, but with this knowledge, I hope to only improve my skills quicker and more thoroughly. Furthermore, in my future practice as a paramedic, I have knowledge regarding CIS aspects regarding clinical handovers that can be improved upon. Understanding the potential barriers and complications of clinical handovers, I can prepare myself and work to break down barriers that may potentially hinder my ability to deliver a high quality handover. As a future paramedic, I now understand the importance of interprofessional communication, in particular the importance of delivering high quality clinical handovers. I will ensure as a paramedic to continue my education and employ a variety of strategies and knowledge regarding clinical handovers. Of course, I only want to provide the best possible care to all of my patients, and by becoming a well-practiced and experienced healthcare clinician that provides excellent clinical handovers, I will be contributing to positive patient outcomes. Thank you.